10% of Californians have gotten at least one dose of the COVID-19 vaccine.
But some aren't waiting their turn. In tonight's KPIX 5 original report, Betty Yu shows us how some people are jumping the line and the weak link in the system they are exploiting.
Absolutely.
I would absolutely get a vaccine.
Yes, I will.
I look forward to getting the vaccine.
But ask if they would cut in line to get a dose. An emphatic no.
It would be tough to consider jumping a line where, my parents are in their mid to late 60s.
That said, some truly bad behavior has percolated into public view. A Canadian mogul and his wife allegedly violated public health rules. Authorities claim they chartered a private plane, flew 300 miles to a tiny community in the Yukon, ignored quarantine, posed as new motel workers, and got COVID shots intended for the indigenous elders.
They should be ashamed of themselves.
Or this paramedic in Florida. He was arrested for pocketing 3 doses intended for first responders. According to the sheriff, he did it at the behest of his supervisor, a fire department captain, who wanted them for his elderly mother. The captain was also arrested.
I only have one question for them. What were you thinking?
And while these cases are extreme, experts believe in the Bay Area there is a mad dash for vaccines, all on an uneven playing field.
I don't think anyone should think they're above having this happen.
Global public health expert Dr. Taryn Vion at the University of San Francisco specializes in the corruption and abuse found in healthcare systems. She says inequalities in the U.S. system can lead to jumping in line.
Our system privileges the wealthy. It privileges people who have health insurance, who have jobs, who have permanent housing. And so those people are more likely to get closer up in the line and to try and influence the system.
Add to that a chaotic rollout of a limited vaccine supply during a deadly pandemic.
There is confusion, and where there's confusion, there's always problems.
Dr. Allison Bateman is a medical ethicist at NYU. As to the scope of the problem?
Well, we don't really know, honestly, because record keeping and reporting is one of the weaknesses of our system.
But the anecdotes are plenty. They include preferential treatment for big donors, bribes, traveling to another county or state, giving leftover vaccines to people you know, doctors hiring family members as temporary healthcare staff so they can get vaccinated. And
the one that I've seen that actually, hit me the hardest was the idea of temporarily placing your elder in a nursing home so they could get access.
As for the Bay Area, Santa Clara County Public Health took action and suspended additional vaccine doses to Good Samaritan Hospital. The move came after the hospital offered to vaccinate teachers and staff at Los Gatos Unified School District before reaching out to more eligible, higher-risk individuals.
Affirmatively suggesting that staff should sign up, registering themselves as if they were healthcare workers.
The hospital regrets what it calls a mistake and submitted a plan offering stronger checks and balances.
But it is a big deal because it affects people's trust.
Experts fear distrust in the vaccine rollout will only encourage people to take matters into their own hands and not wait their turn.
It's painful.
John Jacobo helped to launch San Francisco's first neighborhood COVID-19 vaccine site in the heart of the Mission District. The goal to provide vaccines to an underserved community hard hit by the pandemic. But there are already reports of wealthier outsiders coming in, seeking vaccines.
And this goes out to my worried well, the folks that are more affluent, that live in very nice neighborhoods. I ask that you really think about whether or not at this particular moment you need to get this shot.
As for California, the state has new streamlined eligibility rules based on age and has hired Blue Shield to allocate vaccines and maintain a centralized database. The hope?
That's going to help a lot to even out some of these discrepancies.
Time will tell if Blue Shield is up to the task. In the meantime, in order to restore more confidence in the system, experts say we'll need more money, more people, and a reliable supply of vaccines. In San Francisco, Betty Yu, KPIX 5.
And the scams are not just local. The federal government is also warning the public about vaccine scams, including ads on social media or Craigslist promising early access.
Until there is a more reliable supply, you should always go to an official source.